Hello everybody, I am Dr. Arun Sharma, neurologist working at Emirates Hospital Clinic, Conrad Tower, Sheikh Zayed Road. I specialize in multiple sclerosis and I will be covering the basics of MS with you today. MS will divide our talk in 4 headings. What is MS? Who gets MS? How do we make diagnosis? And what are the latest treatments available? MS is an autoimmune disorder in which body's immune system attacks the myelin sheath of central nervous system. Central nervous system means the brain, the optic nerves, and the spinal cord. The myelin sheath is like insulation on an electrical wire, and when myelin sheath is damaged, the electrical wire or the axon is exposed, and that slows down the conduction velocity in the axon and results into deficits in these areas, either the optic nerve or the spinal cord or brain itself. And this kind of damage then, if recurs again and again, can lead to lasting neuron damage, and those damages are called lesions or scars. That's where it gets its name from. Multiple sclerosis, multiple scars. The repeated damage to the nerve fibers lead to deficits in these areas: optic nerve, brain, or spinal cord. Mostly we find patients who have had several years of MS and then they come to us with difficulty in walking, difficulty in balance, or difficulty in seeing, or cognitive deficits. Now, who gets it? It's commonly seen in ages between 20 and 40. Women are affected 3 times more commonly than men. The latitude, the northern and southern latitude are affected more with MS, like Australia, New Zealand, Canada, Northern Europe, and North America. Vitamin D deficiency has also been known to contribute to occurrence of MS, as well as people who have MS and have low vitamin D will have worse MS progression. It's also been connected to occurrence of Epstein-Barr virus in the past. Epstein-Barr virus is the same that causes infectious mononucleosis. It has also been seen more commonly in people with obesity, cigarette smoking, or people with other autoimmune disorders like inflammatory bowel disease. There are 4 key steps to diagnosis: historical evaluation, examination, MRI, and spinal fluid analysis. Treatment-wise, in acute stages, every doctor knows that we have to give intravenous methylprednisolone. Otherwise, for prevention of further relapses and further lesions, there are about 24 medications approved by FDA. Now, which medication to choose depends upon a mutual discussion between the patient and the doctor, and it's a very detailed kind of analysis of various risk factors patient has and various possibilities the patient have in the terms of side effects, and then we arrive at a right kind of medication. The ideal interdisciplinary team should include a physiotherapist, an occupational therapist, a physiatrist, an ophthalmologist, and a psychologist. As we speak, there are scientists in the world working very hard at expanding our knowledge of MS and at finding new treatments and procedures to treat MS more effectively with less side effects. Thank you. Bye bye for now.